6 implants up top and 6 on the bottom type case. And I started it off, first time I've used the Nutra product. And so I used the short gauge, the little 1/2-inch needle.
Right.
Just to, I did 6 mLs around the upper palate, and then did another 4 on the bottom, blocking, because she's edentulous, so you have to numb the whole mouth to see your guides have to be fixed before getting started. And I'm telling you,
yeah,
I hate that part because it's so many injections, and it's just like you're starting this pain train, and that just putting those drops of anesthetic around the tissue. I mean, it's crazy. She didn't flinch, nothing. I mean, it's ridiculous. And so even the palatal injections, she hardly flinched, like nothing. She's like, I didn't feel. And so then I came back with regular full Lido, just, a couple here, there, and then you piggyback some Marcaine in there because they're long procedures and you don't want to be stopping and giving more anesthetic.
Correct.
But it just made that whole process of getting her numb, which normally I dread, so much easier.
It really is. And I had a patient 2 weeks ago. He came in, emergency patient, and he was just so upset. He goes, I have to go to Europe tomorrow for 2 weeks. I know I have an abscessed tooth. And we took an x-ray. Sure enough, it was abscessed. And he said, no one can ever get me numb. I don't know how I'm going to get through this. And I said, well, you're going to do great. I got just the perfect thing. We got him numb and comfortable, did the pulpotomy, texted him like the next day. He was on the plane. He says, I am doing great. And I don't think, because that tooth was so hot, I don't think I ever could have gotten him numb if I hadn't had something that really worked like that. Or at least it wouldn't have been nearly as easy. So that's like the cool thing.
Yeah, it is.
So I'm so glad. That's so good to hear. I love that. Well, do you think there's enough of us that we should get started or wait just a little bit? Everybody ready to go?
You got a good crew on here.
I'm ready.
Okay. Oh, hi, Ike. Hi, Dr.
Hey.
All right, everybody. So, first of all, bear with me. I've never done this before. I appreciate it. I don't want to babble. I'm going to try to keep this short and sweet. So, I think we have doctors, but I think we also have support folks. So, let's go ahead. I want to do a welcome. I want to thank everybody for joining us tonight. I want to thank our RMO, Melanie Almeida. She couldn't be here tonight, but she knew we needed to keep moving forward with this, that it was very important. I want to thank Dr. McCormick, Dr. Campoletto, Dr. Edwards, and also I want to thank Dr. Gibbrey, and last but not least, John Hinton. He's the Director of Education and Support with the Nutra Medical. And then I also want to thank Dr. Mongrain, Dr. Robert Mongrain. He's our dental materials specialist, and he's in charge of making sure that the products that are trusted products are products that actually work and are beneficial for us. And so he wants me to keep moving, or wants all of us to keep moving forward with the grassroots effort, as he says, to reach out and introduce a Nutra to like-minded clinicians who would be willing to try something new that might work really well for their patients and for them. That way he gets the information he needs on the product. So when we share that information with him, that helps all of us. So some of you may know how buffering works, some of you might not. So let's just be sure we're all on the same page. So just a real quick background about buffering. So basically buffering is very simple. So our dental anesthetic comes in either a little carpule or it comes in a vial. The vials can be 15 mLs, 30, 50 mLs, and our little carpules are like 1.8 mLs, the dental carpules, so very tiny. But in order to give those shelf life and protect our patients from infection, they have preservatives in them. And those preservatives are very acidic that make the anesthetic have an acidity of about that of a lemon at 3.5 pH. So our bodies are about 7.4 pH. So even with the best technique, the kindest and most gentle injection, it's going to sting. That anesthetic is going to sting pretty good when that lemon juice hits our tissues. So, and it doesn't diffuse as well in the tissues because the pHs are different. So in comes buffering. Medical, they've been doing buffering for years. This is not anything new, but they buffer the anesthetic with sodium bicarbonate. Now, the key is how do you get that right ratio? And that's what Anutra has done so simply and so beautifully and so easily with their invention. So how it works is you take a certain amount of sodium bicarbonate, which is the buffering agent, and you combine that with the dental anesthetic. That buffering agent is alkaline, and so it buffers the acidity of the preservative. And that results in a more neutral pH of the anesthetic. So now you see where we're going here. The body's 7.4. We've got the anesthetic now with buffering down to 7.4. When we give that injection, the anesthetic, not only does it take half as much to give more profound anesthesia, because it diffuses through the tissue so easily, it's taken up much faster, and it's a much more profound feeling. Okay, so half as much, works faster, and it's more profound. So me as the patient, I'll take that any day, and me as the dentist, I'll take that any day. So also it's a more clean finish, and I don't know how to describe it, but if you ever have an opportunity to have an injection with it, you'll notice that when it wears off, it's a clean finish. So what Anutra did is they came out with an invention that allows both the vial of the sodium bicarbonate and the vial of the anesthetic to remain sterile. They have a smart site and a clean syringe, prepackaged syringe, disposable syringe, that allows each ml to be drawn up in the proper ratio. So you can dispense anything from 1 ml in this syringe all the way up to 6 mLs. 6 mLs is enough to really numb an entire arch on the maxillary arch. Probably about 4 mLs will do the job. Don't know if anybody heard Dr. McCormick before the meeting started, but 4 mLs is really all you need for the lower arch. So if you think about that, 4 mLs, I mean, that's 2 carpules for an entire arch. That's really good. So I hope everybody's comfortable with how that explanation for buffering. So the main thing, last spring I went to communications class in South Carolina with our team, and I heard Dr. Bloink speak about saying yes to more dentistry. And so it kind of clicked with me that if we could numb our patients more efficiently, give our patients a better experience, and give ourselves the ability to do more dentistry on the patients that we had in the chair, maybe we could add dentistry to our day as well. So I've been using Anutra now for about 8 years, and our schedule has gradually changed over that time period. Our ability to produce more dentistry in the same amount of time has increased, because we don't jump from one patient room to another trying to worry about a patient getting numb over here, and then I've overlapped over here, I finish this up, and then I go back over here. We've stopped all that insanity of running from room to room. It works much better with our team because we're more comfortable, we're more relaxed, it's more efficient. Patients listen to our treatment plans. We have time to talk to patients more. It's a practice builder. It makes it easier to treat same-day emergencies. It's easier to get teeth numb because the pHs help the anesthetic perfuse better. And it helped us to do our same-day crown procedures more confidently and more effectively. So we had also for our hygiene, it really helped us boost our hygiene production. We could now do 4 full quadrants of hygiene in 2 hours in one appointment rather than split it up into 2 separate appointments at 1.5 hours each. So we saved an hour, saved an appointment, so we could add production in the hour that we got back. So we figured that on average, a Nutra saves us, anywhere 10 minutes a patient every day. And if you add that up, that's also about an hour of time if you're being conservative with 6 patients. So that's kind of my summary. It helps in so many ways. What I'd like to do is I'd like to turn it over to Dr. McCormick and let Dr. McCormick speak, if he's able to, on what a Nutra has brought to his practice and how his patients have done with it and what he's observed. Dr. McCormick.
Yeah, so we started using Nutra, I think like maybe a month ago now. And I love it. I think there's definitely there's a learning curve to it, but it is an excellent product. It has, the anesthetic soaks in quickly. There's no doubt about it. You don't have to use as much. In terms of managing a schedule, that's my favorite part. It gives me an opportunity. If I'm running behind, I have a chance to catch up because it sets in so fast. I don't have to leave the room, which I do appreciate. And those simple components right there to me make it worthwhile. And giving the anesthetic, putting those couple drops on the tissue before you get started. One drop, make sure you dry the tissue well. You can't just you can't fake dry it. You got to dry it. Air dry it. 1 drop, count to 5, dry it again, 1 drop. When you get through that tissue, they will not feel it. And, go slow, obviously, but the patient will, I've gotten more, and I give a good injection. I know I do.
I know you
do. With the feedback I get from my patients. But there's a discernible difference with, the more comments in the last month with, I didn't feel a single thing. That was crazy type feedback. So it's a great product. Like I said, there's a learning curve to it. I think learning to not use too much. I think I find myself wanting to give the same amount as I do with lidocaine, and you don't need to. So that's different. Making sure you're not pulling back too quickly on the syringe, so you're getting equal parts buffering and anesthetic, because I think that'll influence, blocks not being missing blocks. I think that can be an issue, but the barrel's different, so there's a learning curve.
Right.
But once you get past those hurdles, it's a good product. It's one of the better ones I've ever, and I've done all sorts of the vibrating Ligajet thingy. I've done all sorts of different products, and because we're always looking for the holy grail for giving anesthetic that's painless, and this is definitely the best one I've experienced so far. So I appreciate Lisa, you bringing that up to us and introducing it to our office, because it's been a win for us, no doubt.
Well, I appreciate that you were willing to just try something, and that's part of the key. And as Dr. Mongrain had told me, he said, I'm very familiar with it. I think it's a great product, but he wants to get the information back from dentists like you, me, and all the other dentists out there in our area. He wanted to keep it small. And tell me a little bit about your hygiene. Tell me how that's working for you with your hygienist, because I think all of your hygienists, or most of them now, give their own anesthetic, correct?
They do, yeah, all of them, yeah.
Okay.
Yeah, and yeah, the feedback, is just positive. They're getting through their SRPs quicker. We haven't shortened our blocks, so we're not going to be doing that. But I know it gives them more opportunity to, catch a break, type their notes, that sort of thing. We all like, how quickly it sets in, and it being profound is, it's when you save that time in a dental office and your schedule, if you save 5 minutes, that 5 minutes that you save when you don't.
Oops.
15 minutes. Like a lot of times when you get sucked out into to go do a hygiene check, and the patient turns out to be a chatty Cathy, and you're sort of, your flow gets disrupted when you leave the room. And if you're able to stay in the room, whether you're a hygienist or a doc, the time savings is just so nice. It really is.
Great. Thank you so much,
Sure.
Dr. McCormick. Dr. Campoletto, are you able to tell us about your experience and your patients?
Yeah, I'm going to leave my video off so I don't crash and lose the call. But yeah, I will. I'll second everything Dr. McCormick just said. Right now I'm a bit of a nomad these days until my de novo opens, so I don't have it currently in my office that I'm in, but I had the chance to use it for about 2 months before I went out on my travels, and it's definitely a game changer. It's one of those things. John gave his presentation. You sit there and you're like, yeah, this is. I don't know. You're kind of skeptical. Same kind of thing. If anyone's ever used a laser to desensitize, a tooth, you're like, there's no way. You don't believe it. Tell patients it's hocus pocus. Same thing, but it works. It's incredible. The day, a couple of stories on our end. The day that John came in, showed us everything, gave us our training. We had a crown patient. I think it was number 18, 19, something like that. I think we drew up 1 ml. And before we were even done the injection, the patient was already like, whoa, I have never been this numb before in my life.
Right.
And that's half a particle of normal anesthetic, and she was good to go within, 30 seconds to a minute. The biggest thing that I've seen that's been great, working on kids is not my preference at all. I do it, and, we all have those kids that are just not compliant, and using the 30 gauge short, super short needle with a 1 ml syringe, it's easier to hide from the kids. But then if you use the anesthetic to get them a little topical effect as well, I've had far better success working on kids with this than ever before. And it, of course, is very profound. Definitely, with the hygiene, it helps. Our girls aren't certified at this point, so we still have to go and numb, but the fact that we can do it and they can turn around and sit right down and start working, our 80-minute SRP appointment turns into half that time. So it's increased. We'll say, same day new patient, this new patient appointment's 80, 90 minutes anyway, they need an SRP. Well, we can still do it today because I know that you can get numb and we can get it done in half the time that we would anyway. But it's definitely beneficial. Works fantastic for, hot teeth, infected teeth. We pull a lot of teeth, and there's patients that you just know looking at it and looking at them that they're not getting numb with typical Lido and Septo, and you throw 1 ml of the buffer in there, and they're there. So it's been great.
Well, I am really glad to hear that. I think there's a learning curve with it, but it's not you think it's going to be intimidating, but it's not really intimidating. And Anutra provides all the support to help answer questions, any troubleshooting, things like that. Have you found that they've been helpful for you?
Oh yeah, absolutely. John's been great. Any questions we have, I know we had an issue when we first started, and he took care of it. And the follow-up's been great. So yeah, great support.
Great, thank you, Dr. Campoletto. I'd like to now turn to Dr. Edwards. Dr. Edwards, He is a young dentist. He graduated in 2019. I'm really proud of Dr. Edwards. He really probably got off to a rough start. He had no sooner gotten started than COVID hit, and 2020 was sort of a bust because it kind of barely got started, had to kind of close down and start up. But 2021, Dr. Edwards, he made President's Club. In his first full year of our affiliation with Heartland, I am just totally amazed at his sense of professionalism. But if he could speak a little bit to how he feels Anutra has maybe help him achieve what he's already working on and working toward, I'd appreciate that. Dr. Edwards.
Yes, to piggyback off what's already been said, it really is simple, amazing, and it works the way they say it works. I'm able to add so much dentistry to my schedule just out of hygiene alone. Today I had a patient emergency, and it ended up just being something simple. The patient gave himself toothbrush abrasion, and I had 40 minutes, and it was obviously, nothing I could do anything about, but I said, hey, we have a couple fillings that you haven't, come in to have done. I've got some time. Do you want to stay and do those? And he said, oh, yeah, then I don't have to come back. That's great. So in that 40 minutes, I did 3 fillings on him that wasn't even on our schedule for the day. It's something that I don't think has been said, that I was just thinking of when Dr. McCormick was talking about his hygienist giving injections. I think it's going to be an amazing tool for hygienists who are, just now learning to give injections. They're going to be able to confidently get their patients numb without, any worry. I rarely give an injection with Anutra that I have to re-inject for. It's once in a blue moon, and in dental school, using non-buffered anesthetics, I always had to re-inject, I felt like, and I just don't have to do that at all with Anutra.
Yeah. I think also we've all been there as a young practitioner starting out and trying to establish yourself credibility and build trust and rapport with your patient and getting case acceptance. I see where with Dr. Edwards, what I have observed is it seems like it just takes the worry that he might have in the back of his mind. Will I be able to perform? Will I be able to get this patient numb? Will I be able to give the patient the experience that they want or they deserve? And I think it just clears all that up, and then he's able to really focus on all the other wonderful things that he can do for the patient.
It definitely does. I'm sorry.
Yeah, go ahead.
I came into a very established practice with patients who have been coming there for 30 years. And so the patients who come in and are willing to give the new guy a try, they might be a little apprehensive. And, when you can really make a good first impression, get them profoundly numb, not have to re-inject, it says a lot. And relieves the patient. I get many compliments. Wow, I didn't even feel that. That was great. And wow, I was so numb. I'm glad I gave you a try. Things like that.
Yeah.
It has been a practice builder for me because it's built patient's confidence in me.
Yes. Well, I appreciate you sharing your experience. and I think that's really important. Number one, the best referral you'll ever get is the one that's word of mouth, and when they tell other people. Thank you, Dr. Edwards. Last but not least, I'd like to introduce, bring John Hinton into to talk about the support that Anutra brings. He is not a pushy salesman. He is here to support if you want to invite him into your office. There's, like I said, he is just here to give you information, follow up, and that type of thing. John Hinton.
Dr. Mays, thank you. Again, thank you everyone that's on the call. So again, thanks to Dr. McCormick, Dr. Edwards, Dr. Campoletto, Melanie, as you mentioned, to put this together. We've been really excited to partner with Heartland Dental on a corporate level. Back when I first started and went up and trained clinical director, Dr. Hansen, and started from there and worked with Bob Malmgreen. So we're getting the support, and we are excited about the soft rollout that we've had. So now we're ready to expand it. So here's how you can get involved. Basically what we do is we do an in-office training for about 45 minutes during lunch or whenever that may be, to really go over a little bit about buffering, what the benefits are to the practice of the patient, but focus really on how to use it, what the system's about, how to put it together, how to make sure your staff is very comfortable and successful with it. And then we talk about some clinical tips that many doctors like Dr. Mays, Dr. Dan Davidian, who was the local dentist in North Carolina, they helped develop this, and others through my experience to come up with some tips that really help you be successful with buffering. So we spend that 45 minutes introducing it to you, and then we stay around while you use it on several patients in the afternoon, just to be there to answer questions, make sure the staff's using it properly, answer questions the clinicians have, so that we set you up for success going forward. We also then have a follow-up protocol where we text and talk just to make sure things are going well, because one of the things we really pride ourselves in is giving world-class customer service, and I think we do that. So that being said, what we'd love to do is I'm going to give you my information, contact information, if you have an interest in either learning more, or if you want us to come in and allow you to use it. There's no obligation, okay, with this. And so, but we believe once you do it, you're going to have the same feedback that you've heard from these 4 doctors about the system. But what we do is we'll set up the time, we'll bring the product in, allow you to use it that day, and again, probably for a continued on a week or so that you can really become comfortable and decide if this is the right thing for you. The one thing I will say, and again, we'll talk about price and other things, I know that comes up. What I will say is we've got a very aggressive program with Heartland that allows you to have the benefits of buffering for practically the same cost of what you're spending for your current anesthetic. I know that sounds crazy because you heard all these positive things, but Dr. Mays, as part of our case study for Dr. Mongrain, went through that and did this deep analysis. So I'll be able to share that. So here's what we've got. The ability for you to try it, no obligation, you decide, and then we'll talk about what it is like moving forward, knowing that you can give your patients great care and dental experience, help you clinically with anesthetic, which we know is unpredictable, and then we'll give you the opportunity, if you want to move forward, to get on a program that allows you to basically spend the same that you're doing now. So I'll just kind of leave it at that. I hope I covered the points you wanted me to, Dr. Mays. I look forward to meeting each of you and bringing this technology to your office.
Thank you, John. And last but not least, again, it is very, very simple and easy to use. Yes, there is a learning curve, but I really, I want to try to get as much information to Dr. Mongrain as possible, the feedback that he needs to do the stuff that he does, to do green hearts and all that kind of thing. But I want to know when I do something, when I select a product, I want to know if it works. I want to know if it benefits my patient, and I want to know if it benefits me. And I think the stress reduction that I've had using Anutra, the pain reduction I've had with my patients, and the increased production that I've had, I mean, it just makes it easier for everybody. And I'm not saying there's no learning curve. Yes, there is, but it is not a steep one. It is really low going and very easy. But all of you, thank you so much for listening tonight. And doctors,
Dr.
thank you
Mays.
so much for participating.
Dr. Mays.
And if you have any questions, again, please reach out to me. I'm always available. I can answer any kind of question for you, and I appreciate it.
Hey,
Thank you so much.
Dr. Mays.
Yes.
Can I, before everyone leaves, I did not give you my contact information.
Oh, yes. Do
Okay,
John, please.
so John Hinton, Hinton. My email address is John, JOHN.Hinton, HINTON, at anutramedical.com, and that's ANUTRA medical.com. John.Hinton at anutramedical.com. And my phone number, maybe the easiest way for you to reach out to me, is 919-210-5412. I'll give that to you one more time. 919-210-5412. And again, I look forward to meeting everyone and working with them to integrate this technology in your office. Thanks for your time this evening.
Thank you, everybody. Good night.